Well, with the return of football season, fans are flocking to stadiums across the country. In a Politico article, Dr. Christine Petersen describes nervously watching a crowded game between the University of Iowa and Penn State University. She feared the game would lead to many infections, but thankfully, that did not happen. So let's bring in Dr. Petersen now to discuss this. She's the director of the Center for Emerging Infectious Diseases at the University of Iowa College of Public Health. I, too, have watched some of these gatherings on TV, biting my nails, thinking, oh, man, this is probably a petri dish that we're looking down on there. But, you know, things have changed from what it was like, you know, even at the beginning of the year when many people had not been vaccinated. So the Iowa and Penn State game did not cause a spike in cases. Does this surprise you?
Honestly, when we think about what we are most worried about with those outdoor events, I thought a packed stadium, sold out, with people sitting, you know, right next to each other, screaming at the field, screaming at each other, and consuming alcohol would be the worst case scenario. If anything would cause transmission outside, that would be it. But we didn't see it.
So a South Dakota town hosted a motorcycle rally earlier this year, Doctor, as you're well aware. Afterwards, the county saw a greater
than 1,500% spike.
Thank you,
1,500% increase. But then, you know, when they took a look at the Lollapalooza festival in Chicago, there wasn't a major surge in cases. So can you explain that? You know, we're talking about large groups of people. I know that perhaps the motorcycle rally, I believe this is the Sturgis motorcycle rally, would have attracted a different crowd. And also South Dakota has taken a very different approach to COVID, a much more lenient approach. But, you know, why do you think there were such big differences between the two groups? Sure.
Well, with the Lollapalooza event, they did mandate either showing a negative test or proof of vaccination. And then they encouraged mask wearing. Whereas at Sturgis, you know, that's much more of a live free or die sort of event. And they did not make sure that there was vaccination or negative testing. So I think it's really in the approach. And we all know that both vaccination and mask wearing makes a really big difference in the ability of this virus to spread through any crowd.
Yeah, I think it's a really good reminder because that, you know, get vaccinated drum, authorities have been beating quite hard, as they should be, but all that other stuff too, the masking, all that stuff, it counts. It still matters right now. In the article, you express concern for other respiratory diseases going around campus. What are you seeing?
So, as we probably all know, what we see in the wintertime is not just due to one virus. It's usually multiple viruses. And the one that we've seen much earlier and in much higher numbers is respiratory syncytial virus, or RSV. This is a virus that's very dangerous in young children, but we're seeing it in older kids. And we're seeing it cause, you know, essentially outbreaks at schools.
So one of the things that I've been worried about, Doctor, is, and you see a lot of people who say, look, these gatherings can happen, they're outdoors, or even concerts that take place indoors. People are going back to Broadway now. Everybody's masked up, but there are still some concerns. For example, my father's immunocompromised. I know that there have been breakthrough infections. I don't want to be one of those breakthrough infections because I believe, because I've listened to doctors like you, that if I were to be infected, I'd be okay. I wouldn't get deathly ill. But what would that mean for my dad if I happen to come into contact with him? So I do worry that some of these large gatherings, whether they're indoors or outdoors, I mean, I chose not to go to a big concert earlier this summer because of this fear. Is that a rational fear, or should I be living my life as long as I'm wearing a mask and enjoying all the things that we know that we can enjoy?
Yeah, well, we all know that risk perception is something that's very personal, and we need to both try to assess the risk of us and people that are in our community that we want to protect, but also think of our larger community. And I think that's where we've really fallen short, is people are thinking much more about their own personal risks and responsibilities and not necessarily the broader context. I believe that, you know, going to an event indoors is much more risk in terms of the likelihood of getting infected. And that's just, good old dilution is the solution. And when you're in an outdoor environment, there's a lot more fresh air.
Experts, and you are one of them, have warned that, there's another COVID coming. Maybe not exactly the same, but we can expect more of these. They warned that this was coming beforehand. And we've now kind of seen various people do, an autopsy on the way this country handled this pandemic. I want to get your take on things, and I know you can't cover it all, but do you think have we learned anything over the past almost 2 years now? Do you think we are prepared for the next pandemic, or who knows, maybe another version of this very virus?
Yeah, I'm pretty worried, and on multiple levels. I think the two most important ones is we have shown that our infrastructure and our ability in terms of the supply chain is just not adequate for dealing with these sorts of events. And that's both in terms of biomedical equipment, but also everything else. And then the other thing that really worries me, and it's kind of on multiple levels, is because of the challenges and the messaging coming from certain groups, we are losing our public health workforce like no other. And the best and the brightest are choosing to go to places where they don't have to get screamed at. And we really need to change the conversation and understand that, those of us who go into public health didn't do it to make decisions for other people's lives. We're just trying to help people. And science is facts. It's not something that you can choose or not choose to listen to. And I really hope that we can reinvigorate our nation to want to understand what the science means and want to act on it.
Last question for me, Doctor. You mentioned science is fact. Journalism is a fact-based business. I mean, that's what we traffic in, are the facts. But the facts as we know them, when we know them. And those things can change over time. So my question has to do with the efficacy of the vaccines that we've all received. We're seeing a lot more breakthrough cases right now, which of course leads some people to try and spread misinformation to say the vaccines are not working. And so why are we pushing to vaccinate everybody? Why are we implementing vaccine mandates if we've seen folks, as sadly as we've seen with General Colin Powell, to others who've had received or who've been infected even after having been fully vaccinated. So the question that I have then has to do with how long the protection of a vaccine lasts and how critical will it be for us to get boosters. I mean, I was in Haiti, for example, a few months ago in the wake of the earthquake, where very few people are vaccinated. And literally, I mean, most people don't wear masks. I wore a mask. I'm fully vaccinated. I did not get an infection. I was pretty surprised. I was pretty happy about that. I suspect it's because we were socially distanced. Most of our reporting took place outdoors, and we were always wearing a mask. But I wonder if it would be the same if I were to go now, given what we're starting to see with breakthrough infections. So do we know how long that protection lasts, and when do you think we will need a booster, even though they're being approved right now for certain categories of the population?
Well, congratulations on traveling safely and coming back without an infection.
Thank you.
I think it's a moving target, and that's why I do appreciate what you're saying as journalists and both as scientists. We're trying to take the evidence we have and draw conclusions. But as we've all talked about, this virus, because of its very nature and how it replicates, is always changing. And that means that the efficacy, as we get new variants, will change. Do we need boosters? Certainly the people over age 65 and those at high risk because of immunocompromise, yes, you need to get boosters. Will everybody need to get a booster? Based on what we know about virus behavior, the chances are very high that we're going to need to have a different formulation of vaccine to work against what we're going to see in the future. And And in the meanwhile, as you were saying, we need to take that approach of as many measures of protection as possible. So as we head into the winter, we really do want to remember again all that hand washing that we were doing a year ago. We're going to need to try to be better about masking, and not so much because of SARS coronavirus 2, but, flu is coming, and we have all these other respiratory diseases. And when you're sitting together in crowded places inside, I just know from my own lecture halls, when you come back from Thanksgiving break, you hear a lot of coughing. So let's all try to up our game a bit as we head into this new season.
All right. Dr. Christine Petersen, thank you very much.
Thank you.